Dr. Graeme Groom is a British orthopaedic surgeon. He's volunteered in hospitals across Gaza over 40 times. He's at the Al Jazeera Forum. He's joining us now. So thank you very much indeed for being with us on Al Jazeera. We were just hearing there about one of the innovative ways that a doctor is getting around the lack of supplies of medical and medicines in Gaza. Can you talk to us about your experiences when you were in Gaza?
Yes, I can. Most recently in May, I was based at the Nasser hospital with my colleagues, and during our visit, the hospital pharmacy was bombed. We are very, very familiar with the shortages, and as the pharmacy store was bombed, they became more acute. The problem with shortages of medicine is it sounds almost benign, but we have colleagues who are in Gaza every month, and last night a colleague sent an urgent request for an antifungal drug called amphotericin. Now, she wanted this for an 18-year-old girl who had a very rare fungal infection, mucormycosis, as a consequence of diabetes, multiple comorbidities, poorly treated because of the shortages. And her very last message was, "This is an emergency. The fungus is eating her face." So that is, when we talk about shortages of medicines and we talk about lists of that are at zero stock, both of medicine and of surgical equipment, it doesn't sound quite as dramatic, but the individual impact is absolutely huge.
Now, Israel is supposed to be allowing in aid and medicines because of the ceasefire. Are you able to compare to us the situation as you understand it now in Gaza compared to what it was like before the start of the ceasefire?
If anything, I can't speak for the supply of medicines because we're more concerned with the supply of surgical equipment. What has happened before the ceasefire and has continued since it is there has been a tighter and tighter squeeze, so that when we travel from Amman through Allenby Bridge and Kerem Shalom, we were earlier, before the ceasefire, allowed to take a certain amount of equipment with us. We are now allowed to take nothing. And when I say nothing, I mean an anaesthetist had his stethoscope confiscated on the basis that he wasn't going to listen to his own heart, was he? There is, as with everything in Gaza, there's a tightening and relaxing of the rules, so that was at its tightest. We're now told that with sufficient advance warning, we can take 2 small boxes of equipment in at each visit. That is very unclear. The definition of what that means is unclear. And of course, there's this immense problem of dual-use items. Anything that is defined as dual-use is prohibited. And you may know, or you may not know, that tents are defined as dual-use because they have poles.
Just very briefly, sir, it was reported that around 20,000 people were in need of urgent medical care in Gaza. The Rafah crossing has now, of course, opened with the purpose of allowing people out to get that treatment. What is your assessment of how effective that is going to be? Just briefly, sir, if you don't mind.
Yeah, at the moment, the number who are evacuated is a trickle. There is a much larger number of between 20 and 25,000 who need long-term treatment, and that is our specialty. What is required is, first, those who cannot be treated in Gaza are allowed out, but more importantly, that we are allowed in with our equipment.
Dr. Groom, we appreciate you joining us on Al Jazeera. Dr. Graeme Groom, a British orthopaedic surgeon. Thank you very much indeed for your time.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news, expert insight. Like, share, stay ahead.